Now, this is one of those be careful what you wish for situations. Every dentist wants to be successful, and SmartBox has worked with thousands of dentists to help them attract better patients. It also turns out that having an abundance of just more patients is a mixed blessing for a lot of doctors. If your daily schedule is looking more and more like a train wreck than something you look forward to doing, stay tuned. When we come back, I'll tell you the secret to working less and earning more. Stay tuned. Thanks for watching the Patient Attraction Podcast. I'm Colin, receiver. You know, it's funny how things turn out. I set out years ago to help dentists get more and better patients, and I'm happy to report that has succeeded beyond my expectations. But I've also been talking with a lot of dentists recently, and do you know what they're telling me? They say something like, Colin, I don't need more patients. I'm practically on roller skates right now between the operatories, trying to keep my schedule going and see all the patients. What I need is fewer patients who pay more. Now, I know there's a lot of dentists who would love to have that problem of too many patients. And I'll bet that when they got there, it wouldn't be long before they'd say they were working too hard and that they didn't have any time or energy to actually enjoy the life that they're working so hard for. And I get it. Dentists need better patients, and maybe you do too. What are you willing to do differently to attract better patients? A general dentistry approach isn't going to get you there. Look, general dentistry is what it is. It's a stream of relatively low case value patients with the occasional more profitable patient that needs a crown or a bridge. I can't change that, and neither can you. But getting you better patients is all about what we do here at SmartBox. If you're a dentist who's willing and able to emphasize and focus on more lucrative revenue streams, and that doesn't necessarily mean getting rid of your hygiene department. In fact, quite to the contrary, dentists that have taken a focus on implants or dentures or cosmetics, their GP side of the practice has continued to grow. And it doesn't mean not doing those routine exams. It does mean that you have to make the conscious decision to no longer work yourself half to death. Now, you think it can't happen? One of our SmartBox dentists who, with our help, has transformed his practice from GP to one of the premier implant practices in the region. That doctor hired an associate to handle the general dentistry side completely. He's working 3 days a week, only seeing the types of cases that he likes to treat. He enjoys going into his practice. And in 4 years, the practice has grown from 1.8 million to over 4 million. SmartBox helped him, and if you're a dentist who wants to stop roller skating between operatories, we can help you too. So let me ask you, do you really want to work less but earn more? Do you want to be able to enjoy life outside the practice? Do you want to have the confidence to take a few days off every once in a while? Do you want to be able to spend your time handling the cases and the patients that you truly have a passion for treating? Are you willing to do what's necessary to emphasize and focus on those various niches? Then check this out. Here's what you need to do. Give us a call. Let's have a chat. We'll discuss your goals, your capabilities, and in particular, your market area. After this initial chat, we'll put together a strategic plan, what we call our patient attraction roadmap. Now, let's be clear. Not every dentist who wants to focus on better patients is going to be able to do it. You may need additional training or equipment to pursue a more focused area of practice, but it's an investment well worth making if you know you have the better patients and can make it work. Join me for our next podcast. Until then, keep moving forward.